And now to the race to vaccinate in Pennsylvania, where today the state says 3.9 million doses of the vaccine have been distributed so far. The governor and acting health secretary touting today that Pennsylvania is making progress, outperforming its peer states last week. Take a look at this. The yellow you see on this chart is Pennsylvania. According to the state's numbers, Pennsylvania ranks second when it comes to the number of vaccines administered per 100,000 population. This comes as the 4 counties around Philadelphia continue to battle with the state over the creation of a single vaccination site. The Collier counties want the state to release more doses for them to distribute, but the state says those doses will only be available at a single location. Local health experts say that would make it hard for those without means to travel to the vaccine site. NBC10's Deanna Durante took those concerns not just to the state health department, but also to lawmakers who say there is room for change.
As of the end of this month, we are anticipated to be receiving a much higher allocation from the federal government.
Acting Health Secretary Allison Beam announces her 4 pillars, as she calls it, when it comes to anticipated extra doses of vaccine coming to Pennsylvania. She announced her plans publicly today, and part of the plan calls for the entire southeast section of the state to share a state-run vaccination site.
Local control does make sense.
State Representative Tim O'Neill is one of the members of the COVID-19 task force. He says the task force has been a way to help the DOH navigate the COVID crisis. He also says Acting Secretary Beam presented her plans to the task force on Tuesday, and her plans included the single state-run vaccination site for the entire southeast region to share.
I understand there was a communication basically saying that the task force did direct the one site. I will tell you that is not the way that I took the meeting. Again, we did not specifically have that vote.
This is the communication put forth by leaders in Delaware County urging state lawmakers to encourage counties to get the vaccine, but not the site. The 4 counties all say they can administer doses to the at-risk population with clinics in place and mobile clinics to reach people who can't travel. But sources tell us when they presented this counter plan to Beam, she told them when it comes to changing course, it's, quote, out of her control and up to the task force.
I did not walk away from it thinking that the task force had given any directive mandating any course of action to the Department of Health.
So we asked her.
As the acting secretary of the Pennsylvania Department of Health, isn't that precisely within your control?
Sure. Thank you so much for that question. I appreciate it.
And she didn't answer the question. O'Neill says local lawmakers are pushing the task force to change direction and encourage those doses, more than 42,000, to be sent to the county health departments and split for use between the 4 counties. But so far, no decision has been made. Deanna Durante, NBC10 News.